Okay, Shelby, you relax a moment. I'm just going to explain a little bit about acupuncture before we actually do it, okay? Acupuncture has been all around an awfully long time. It's past the test of time, I guess you could say. The oldest medical canon known to man is the Yellow Emperor's Internal Classic of Chinese Medicine. It was said to be written about 2500 BC. That's 4,500 years ago. And certainly we can understand that they had to be doing this and understood it before they wrote a big book on it, right? So we don't really know when it started, but it's been a long time, and it's still going very well today, and it's very good for helping pain and malfunction in the body, along with other healing modalities. Now, let me explain a little bit about how the acupuncture works. All pain and malfunction is caused by a congestion. We call it a stagnation of qi and blood. Now, qi, Q spelled Q-I or C-H-I, is the energetic principle in the body. It's what does the work. It moves the blood. It does the digestion. It blinks the eyes. It does the work, okay? This can be related somewhat to the bioelectrical or the nervous system. Bio means life, so bioelectric, living electricity in the body, nervous system. Then there's blood. Blood can be related to all the body fluids, your enzymes, your hormones, your tears, all of the joint oil or synovial fluid. Any fluids would be yin, and that would be your body fluids, and we just call that blood because it's a fluid. So a stagnation of qi and blood is what causes malfunction and pain from our perspective. Now, a qi stagnation causes an achy pain. A blood stagnation causes a fixed, sharp, stabbing pain. Now, since the qi moves the blood, you can't have one stagnation without the other. But the interplay of those two types of stagnation in varying degrees gives us all the qualities of pain. Numbness, tingling, burning, itching, stabbing, achy, all of it, okay? So the whole idea of acupuncture and other modalities that we use too is to get the qi and blood to flow. I like to tell my patients that we look at the body as something like a garden or a meadow. And it's beautiful, and there's a stream going through the meadow, and it looks really nice. Now, a beaver comes in and puts in a dam. Well, now we have drought downstream, and then we have flooding upstream. So the meadow's not pretty anymore, okay? But we know through observation, if we remove the beaver dam and allow the stream to flow, that the meadow will reestablish itself to the best of its ability. And that's excuse me. That's exactly how the body works. So, with the acupuncture, too much talking, we are trying to remove blockages. Now, you might ask, well, how inserting a little needle, on the foot going to cause the release of these blockages? Well, this is how it works. When we insert the needle into the skin, even though it's not real painful, they're really tiny. I'll show you one. It causes a microscopic amount of damage to the tissue. The body interprets that as an attack or an injury. So it triggers an entire cascade of biochemical, blood, fluids, and bioelectrical, nervous system. And these events cascade, lots of them. And to me, that means flow. So that's how we create the response in acupuncture, is getting the bioelectric and the biochemical energies to flow and remove those blockages. So all of our needles are pre-sterilized and disposable, and I use they're surgical stainless steel. And let me get a couple here. Let me see. Let's put this under your knee, Shelby. Okay, good. May I take these off?
Yep.
Okay. Now pull this up a tiny bit, huh? Okay. Super. So we're going to put it one on the top of each foot, one on the inside of the legs there, one by each hand, one by the elbow on both sides. Okay? Do you have any stuffy nose or anything going on? Okay, if she has stuffy nose or a sinus headache or something, we might put a couple in here beside the nose. We might put a couple up here beside the inside of the eyebrow, maybe one between the eyebrow, even up at the top of the head here that helps with the sinuses. But she's not having any of those symptoms right now. So all we're going to try to do right now is while she's holding this frequency, we're trying to open up the meridian system and allow it to flow so her body will recognize these frequencies as being okay and not dangerous. Okay, so this is a very fine needle. It's about a 36 gauge, more of a Japanese, Korean type style. Chinese generally use a little thicker needle and a little bit aggressive in the needling. I'm not quite as aggressive in the needling, although we do want to get a response because that's what triggers that bioelectrical and that biochemical event to occur. And if I'm just playing patty cake, we might not get anything done very rapidly anyway. So I have a little tube, and I insert the needle into the tube. Okay, and then I put the tube against the skin, and I tap the top of the tube. That leaves the needle in. Now I'm going to put the needle into where, see the toe jump? That was that response. That was bioelectrical, by the way. So we're going to go ahead and do this one on the inside of the leg here as well. Okay. Tap the needle in and go in a little bit here. Okay. Then we're going to come over here and do the same thing. It was pretty tender?
The foot one is.
Okay. Then we're going to get one up here between the thumb and index finger. Okay. One by the elbow. And now I got to get to the other side here. And last one here in the elbow. There we go. Now, if there were some other things going on, say upset tummy or a headache or a bad shoulder or a bad knee, I might add some other acupuncture needles to address that as well. So anyway, that's how we do the acupuncture. It's not real painful, but occasionally you will get a little pinch or a little bite. But it's nothing like a hypodermic needle. I can put about half a dozen of these in the hole of a hypodermic needle. So I hope that was interesting to you. Again, you can always contact us from the site here and email me, and I'll answer any questions you have. Better yet, why don't you give us a call at one of the clinics and come on in for a consultation, which is free, and a session. It's very relaxing and it's wonderful. Also, see our Blue Sky Nutritionals on this site. We're starting to build that pretty good now. We have some pretty exclusive products, so you might check that out as well. Okay? I'm going to let her relax now. How you doing?
Good.
You get to relax a little bit?
Yeah.
Okay, but you were cold.
Yeah.
See, I forgot to cover her. Usually I cover my people. Okay, I'm just going to finish off the treatment now. Shelby's been relaxing, 25 minutes or so. And I'm just going to take the needles out now. Oh. And as you can see, one little tiny leak. That's it. So there is very little, if any, bleeding with acupuncture. Even if a person's on blood thinners like Coumadin or something like that, we never have a worry about the worst side effect that you're going to get from acupuncture is maybe a little bruise. So there you go. Thank you for watching.